I want to thank everybody again for really listening to the restrictions we've put in place and really stepping up, and we appreciate what a difficult time it is for everybody. But I've been overwhelmed with the way in which the community has responded, and we're deeply, deeply grateful. I also want to stress to the community that New South Wales is holding its own in relation to the number of cases. We've seen the number of cases go up every day, and Dr Kerry Chant will talk about that today. But the number of new cases we've managed to stabilise at this point in time. But what still concerns us greatly in New South Wales is the number of cases that are being acquired without us knowing the source, what we call the community-to-community transmission, and that is something we have to keep mindful of, and something that our health experts are most worried about here in New South Wales, the number of cases that are acquired when you don't actually know the source of that case. And that's why we have to maintain our vigilance. That's why all of us have to keep sticking to the rules, and all of us shouldn't leave the home unless it's for those 4 specific reasons that we outlined earlier in the week. And again, I want to thank everybody for that. I also want to talk about the length of time. A lot of people are wondering, how long are we going to be in this state for? Well, that depends on a number of different things, and most importantly and critically, it depends on the health advice. The health experts will advise us on how long we should have these restrictions in place for. Now, the days that the public orders are in place is just a legal issue, but what really matters is what the health experts say to us, and at any point in time they can review their advice, they can provide different advice to us. But as far as the crisis itself, I echo what the Prime Minister said. We're in it for at least 6 months. Until there is a cure, until there is a vaccine, this crisis is something we need to deal with, and all of us have to come to terms with that. And why is it important for us to control the spread? Why is it important for us to maintain these restrictions? Well, many people have heard about the so-called curve. What does the curve mean? What the curve means is if we didn't do anything, if we didn't stop the spread, if we didn't have any of these restrictions in place, literally hundreds and thousands of people may have been presenting themselves to hospitals around Australia as we speak. And the reasons we've put these restrictions in place is to what we call flatten the curve, to reduce the number of people that have to go to hospital at the one time, because we know that until we increase the capacity in our hospitals, until we get more intensive care beds, we won't be able to deal with the massive influx of patients. And we want to make sure that when every patient does need a ventilator or does need a bed, that that's available. And we're not sure of that yet. And that's why we're using this time to make sure we double, triple, quadruple our capacity in our health system, because no health system anywhere in the world has been built for a pandemic, and that's what we're dealing with. Earlier in the week, I expressed a call to arms to our businesses to really step up and tell us how they might be able to retool, change what they're doing to provide those much needed medical supplies. And I'm so proud that many more than 500 of these businesses have registered with us, and we're going through each one to make sure we get access to PPE and other medical supplies to boost up our capacity, to make sure the hospital system is prepared as much as possible when the number of patients increase, which it will. And we're looking forward to making progress on that front. But I want to thank all those businesses who've stepped up and really are working with the government, and also those people in the private sector who are also offering support to us to really step up and allow us to get those supplies, because we know that the supply chains around the world are disrupted. Places we used to buy products from no longer exist. The supply chains aren't there. So we are sourcing as many supplies as we can to make sure all of our hospitals in New South Wales, and also people in the community working, have the equipment they need to do their jobs. And that's why it's important for us at this time to use this time to do all those important things. But again, I also wanted to say to businesses, we know you've done it tough because we've had to keep the community safe. Many businesses have suffered, and that's very heartfelt, and we appreciate that. Many people are concerned about their jobs, but I also do want to say that through the federal government's initiatives and through initiatives the states are doing, we're providing every support we can to the business community. And today I'm very pleased the Treasurer is joining us, Don Perrottet, and also the Minister for Small Business, Damien Shutdown, because whilst there's been quite a lot of support offered for businesses who pay tax, where we've waived them or we've deferred their tax or we've reduced their rates and charges, there's a proportion of smaller businesses who don't pay payroll tax or other taxes who need that support, and that's why the Treasurer will outline today a special package we have in New South Wales of providing a $10,000 grant to those smaller businesses that don't have the payroll tax burden on them, however, to date have fallen through the cracks, and we want to make sure we support them as much as we can, and I'll allow the Treasurer to elaborate on that. But today is a day when again we thank all of our frontline workers, we thank the community, and we thank everybody who's playing their part during this difficult time. And as I said, the time in which these restrictions apply is completely dependent on health advice. And I'm hoping, as a best case, that we don't go beyond what we have now. I hope that we'll adjust to the current restrictions we have and we manage things in the way we have, because it's not my intention, it's not anybody's intention to have to impose further restrictions on the community. But if all of us do the right thing, if all of us stick to those rules, if all of us don't leave the house unless we absolutely have to, we'll be able to some extent control and contain the spread. But again, the concern is always around the community-to-community transmission, and those numbers are going up. If we can't identify the source, it also means that we can't deal with the spread, and that is something we're worried about. But I'm also proud to say New South Wales is the first jurisdiction to have postcode data available, publicly available. Whenever we have publicly available information, please be assured we'll share that with you. We always believe in New South Wales, as I'm sure many other governments around Australia do, that it's better for the public to have the information. All of us can handle the information, all of us want to know what's going on. And so working through customer service, through Service New South Wales, we've made sure that there's data available which reduces everything to the postcode. You can look up a postcode to see what's happening in your community, because information is key during this process, and we want to make sure everybody has that information. I also again want to stress the Service New South Wales number 137788. Please know that if you have a concern, you can ring that number up, or you can go onto newsouthwales.gov.au to get the latest information, to get the latest advice, and to also get up-to-date contacts of people that can help you depending on your circumstances. And this is really, really important. Please know that someone will be at the end of the phone if you need them. Please know that someone will be available to support you depending on your needs, or provide you with information, because even if you're a business or someone that's worried about their job, or someone that's worried about paying their mortgage or their rent, that you have someone you can speak to if you can't access the information yourself. And whether it's a state government or a federal government support package, Service New South Wales can help you with that. So don't worry if it's not a state government inquiry you have. We're happy to take or provide information on a whole range of initiatives. So thank you again, and please know that we're here to support each other. And please know also in the coming days and weeks, the New South Wales Government looks forward to announcing further ways in which we can help each other get through these difficult times. But I've been very positively overwhelmed with the support the community's shown for the extra restrictions, and I'm confident that if all of us do the right thing, that we'll get through this in the best way we can. I'll now ask our Commissioner for Police to give an update.
Good morning. Thanks, Premier. Can I firstly thank the New South Wales community for coming on the journey with New South Wales Police in what is no doubt a challenging time, and we're receiving lots and lots of positive feedback about the work that the police are doing out on the streets, so thank you. In terms of Australians returning to Sydney Airport, that continues to flow consistently. People are being treated well into hotel accommodation across the Sydney metropolitan area. Some 3,700 people currently in hotels, with another 400 people expected today. I mean, the good news is next Wednesday we will see the first hotel cleared, and I think that will be a real milestone for anyone who's currently in a hotel room. Yesterday when we met, there were 8 cruise ships either docked or off the New South Wales coast. I can say that after a positive day with Border Force and the cruise liners, 2 ships are currently underway and out of New South Wales water. So thank you to Carnival Cruises for that. Sunday we are planning for Royal Caribbean, their 5 ships to be refuelled, restocked with healthy crew heading back to their port of origin, which is a wonderful outcome for all involved. Yesterday there was an operation in relation to Ruby Princess. 1 man was taken off who needed more intense medical assistance, and we will continue to take anyone off those ships who requires New South Wales health assistance. Obviously, we're waiting for an update from Aspen in relation to the Ruby Princess and the condition of the crew. However, again, I can say that after their initial inquiry, no additional crew members needed to come off. But we are monitoring that regularly, and Ports and Police Maritime will continue close contact with the captain of the ship and, of course, Border Force. But we're certainly moving in the right direction. Thank you.
Thank you. I'd like to give the numbers update. So we currently have 2,389 cases of COVID, 91 new cases, and that's pleasing to see a sustained reduction, and that's in the presence of reasonably high testing rates. There are 10 deaths, and currently we have 209 people treated under care. Some of those are in hospital, some of them are in hospital in the home. 42 cases in ICU, and 22 of those people are ventilated. I would just like to urge you at this time, we have got 336 cases of locally acquired infection where we're not sure of the source of the infection. Our investigations are ongoing in order to establish links between those cases. But as we approach the Easter holidays and the time when we might usually see movements of people around, I do urge everyone to not only travel for essential reasons. It is very important that we continue to suppress and do all we can to control the community transmission, and I ask the community to assist us by heeding the warnings around only essential travel. Thank you.